In a detox facility, a clunky EHR has catastrophic consequences for clinical care, for staff morale, and for the people you can least afford to lose. A poorly utilized, frustrating EHR drives staff burnout and turnover in a setting where good staff are already hard to retain. Detox moves fast. Here is the workflow an EHR has to keep up with, and what to look for when you choose software for a medically managed detox facility. We walk the workflow from evaluation through stabilization to discharge, across clinical and medical operations, medication management, beds, and admissions. Detox is the first step in a long journey to recovery, and it is clinically and medically demanding. Your EHR has to keep up with the pace. The software has to carry a patient from evaluation to stabilization, and finally to discharge or a level of care transition without missing a beat. Whether ambulatory, clinically managed residential, medically monitored inpatient, or medically managed intensive inpatient, the same software demands apply. A clunky detox EHR doesn't just slow people down. It hits clinical care, staff morale, and even employee retention, and it strains your revenue cycle. Good detox staff are particularly difficult to retain, and a frustrating EHR pushes them out, which threatens the safe staffing levels patient safety depends on. When clinical documentation and billing live in separate systems, the gaps show up as denials and claims errors that drain the revenue cycle. Medical detox runs clinical and medical operations at the same time. Behave Health is designed to handle both, so the two teams work from one system. Behave Health is designed to make short work of the medical assessments, physician's orders, and nursing notes that are the baseline workflows of detox. The clinical suite is designed to help the clinical and medical teams communicate and cooperate on patient care in one place. Detox facilities weigh three things above all when they compare EHRs. Let us walk through each one. Clinical and medical operations together, top-notch medication management, and software fast enough for a chaotic department. First, the EHR has to handle clinical operations and medical operations at the same time. That means clinical assessments, physician's orders, treatment planning, and progress reviews, working on low-friction, easy-to-use workflows. A good detox EHR supports clinician efficiency and provides unobtrusive scaffolding for healthy revenue cycles and easy billing. Second, medically managed withdrawal frequently involves medication, so medication management and med-pass workflows are non-negotiable. Tapering for benzodiazepines, alcohol, or opioids is often the safest option, and medication-assisted treatment is sometimes started at the detox level of care. Behave Health integrates with Doctor First for e-prescribing and offers point-of-care drug testing and easy lab order functionality. Third, medical detox moves quickly and can be chaotic, so the EHR has to keep order and stay consistent shift to shift. Behave Health is designed to minimize clicks and foster easy communication between departments and across shifts. Patients in acute withdrawal can be unpredictable, and dual diagnosis cases are more complicated still. The EHR should help staff maintain order. To keep a detox department running, Behave Health offers a set of operational features built for the realities of the floor. Simple, straightforward bed management lets intake and clinical departments scan for open and soon-to-be-open beds at a glance. Instant electronic verifications of benefits assist with easy admissions and quick intake timelines. Easy-to-track incident notes capture unusual events, and a high-fidelity medication inventory secures on-site medications. The right EHR does more than store records. In a detox setting, the choice ripples across care, staffing, and the revenue cycle. A good detox EHR attracts and retains happy clinicians, which helps you maintain the safe staffing levels patient safety depends on. Connecting clinical documentation to billing is what reduces the denials and claims errors that arise when the two are kept apart. Behave Health is an all-in-one EHR designed to put the moving parts of a detox facility in one place, from admissions through discharge. Clinical assessments, physician's orders, nursing notes, treatment plans, and med-pass workflows are designed to live in one connected system. Admissions, bed management, and instant evobs are designed to work together so intake teams move fast without missing a step. Clinical documentation is designed to connect directly to billing and insurance authorizations, reducing the gaps that cause claims errors. Stop letting a clunky EHR burn out your detox staff. Book a 20-minute demo of the all-in-one Detox EHR at behavehealth.com. See clinical and medical operations, med-pass, bed management, and evobs built for detox at behavehealth.com.